Good afternoon, everybody. I am very excited to be here today with our fantastic guest. I say fantastic all the time because all our guests are fantastic. This is Gulnar Nikpour, who is an assistant professor at Dartmouth in history. And she is also the co-editor of the Iran page on Jadaliya, so she's sort of an internal informant, if you will. And she will be speaking with us today from Philadelphia. I'm joined by Noura Aliqat, who is my co-host, and this is another episode of Politics in the Name of Corona.
Time of Corona.
Thank you. In the name, did I say name again?
You did.
Okay, so this is Politics in the Time of Corona. Time. And welcome, Golnar, and we are very excited to have you. I'll let Noura lead with the first question, and then we'll go forward with the discussion not only of the situation of Iran, which you will get to, but also of your superb article that you published in Jadaliya 2 days ago.
Welcome with us, Golnar.
Thank you so much, Noura and Bassam. I'm so happy to be here. It's a real pleasure to be talking to you both.
So we're really keen on getting into the weeds of your article, where you interrogate carceral regimes and how Iran has responded to this particular crisis and what prisons look like and the history of prisons in Iran. Before we do that, it is incumbent upon us to ask, how are you and how are you doing during these times?
Yeah, thank you. Like many others, I'm anxious, scared, and angry, but at a health level, I'm doing okay. Most of my, close people are all doing okay, doing sort of daily check-ins, making sure that everything's okay. For those of us who have loved ones in multiple countries affected by the virus, we're doing lots of weird time Skypes and that kind of thing, but hanging in there as best we can.
That's great to hear. And I hope you all remain in health and wellness. So
yes, same to everybody out there. I hope everyone's doing okay.
Thank you. So as I mentioned, you recently published an article on Jadaliya that reflects your scholarship and your intellectual work on the development of prisons in Iran. I guess we'll begin in the moment of the present before we go backwards in thinking about how the crisis has illuminated what carceral regimes mean in this moment, and specifically beyond security and surveillance and policing, prisons mean in this moment. We've seen that a number of the worst crises have hit prisoners, such as at Rikers Island, where now the governor is planning on, they're going to release 1,000 prisoners, but in Iran, they're ahead of the curve, where 70,000 of 240,000 prisoners have been released temporarily. Can you tell us about that?
Yeah, absolutely. So in the article that was published a couple of days ago by Jadaliya, that came out of my work on prisons and prisoners. I'm writing a book on the history of prisons and prisoners and sort of carceral regimes in modern Iran. But also I'm trying to actually keep up with this deluge of daily information on Corona in the Iranian context. So, as we know, the Corona crisis has hit Iran quite hard. As it has very similar reasons to why it's hit the United States quite hard. Its leaders were minimizing of the issue at the beginning, not really letting out full amounts of information. There was a lack of testing, and Iran, of course, also has to deal with the reality of sanctions, which has limited its ability to get medical supplies. And I was trying to find out what was happening in Iran's prisons, because, of course, following the news in prisons for over several years, public health crises in Iran's prisons are not new. There's a lot of public health outcry about the spread of HIV/AIDS in prisons, about the spread of
Golnar, we stopped hearing you. We must have gotten cut off somehow.
Yeah, sorry about that. I'll dive back in and I'll let you figure out exactly how to go from there. Yeah, so before I was cut off, I was saying that there are already a lot of sort of information about the spread of very sort of disastrous spread of HIV/AIDS in Iranian prisons, hepatitis C, tuberculosis. This is something that public health advocates have been very, very worried about. And so when the coronavirus crisis hit in Iran, I knew that this was going to be a huge disaster in its prisons, which have issues with overcrowding. And that has been an issue in Iranian prisons since the beginning. I mean, from the very beginning of Iran's modern prison system in the 1920s being built up, the big problem that it faced is more prisoners than space, right? So it was very clear that coronavirus would cause issues. And then within just a couple of weeks after the crisis hit, there started to be conversations about releasing some of the incarcerated persons there, people who are older, people who are maybe susceptible to illness, and also people on lesser charges or people who haven't been charged yet. In other words, just like in some other contexts, there are people who are incarcerated in Iran who haven't actually been who are awaiting charge or awaiting trial or awaiting various stages of their process. So there was conversation about releasing those people. And in fact, the Islamic Republic has absolutely blown away the rest of the field in terms of being really aggressive about trying to deal with this. As Nora mentioned, somewhere in the vicinity of between 70 to 85,000 incarcerated persons have been released already. The total numbers have bounced around a little bit in the last week. So right now, from the best estimate that I've seen, it's about somewhere in the 80,000 vicinity, with the Supreme Leader, Ali Khamenei, promising potential more releases down the road. Now, that's close to a third of the total incarcerated persons in Iran. I think the official incarcerated persons. I think there's probably a larger carceral regime than that 240,000 gives a sense of, particularly because just, again, the borders are policed, and that doesn't include some, refugee populations who are being incarcerated, particularly Afghans on the eastern border of Iran. But at the same time, that's a huge number, right? Like in New York and in Pennsylvania, they're fighting, prisoner rights advocates are fighting to get 1,000, 2,000, 3,000 people released. Public health experts saying that we need much, much bigger, much more expansive releases. At the same time that they're releasing some incarcerated people, though, in the Islamic Republic, there has been we have evidence from comments made by the head of prisons at Asghar Jahangir, that they have imposed really very, very limiting new draconian measures on the prisons in terms of visitation rights, mobility rights, and so on and so forth. And it's not totally clear to what extent health and hygiene has really been addressed in a sort of forward-thinking way, right? So, of course, all of us are dealing with limitations of mobility, but in a carceral space, of course, that's heavily it's a militarized process, right? So you're being told to do certain things at the barrel of a gun, and visitation rights are already something that prisoners are really punished with when they're not, when they don't, for any number of reasons, visitation rights are taken away from folks. So there have been a number of uprisings in Iranian provinces, in particular, 2 in Lorestan, in small cities in Lorestan, and 1 in Azerbaijan, Iranian Azerbaijan, in Tabriz. And so that was part of the focus of the article as well, trying to get a sense of, okay, we're not actually hearing directly from prisoners, and the government has been extremely tight-lipped about actually letting us know whether or not there have been confirmed cases of COVID in its carceral sites. But we do know that prisoners are to some extent taking matters into their own hands. In two of the revolts, there were escapes. And I think it's quite telling that in one of the Lorestan cases, many of the escapees were people who had only just been arrested in recent weeks and who hadn't gone through the process of trial yet, right? So there are people who are really that's not typically who organizes a prison uprising, right? If it's only your second, third week in incarceration, that's not typically when you're organizing to have a prison break. And so I think that speaks to the level of fear that people are living with in those spaces, in incredible enclosed and cramped spaces. And in the provinces, those prisons are typically much less well kept. They have much poorer hygiene, less access to clean water. The one in Ali Godars, which was one of the revolts, is one of the sort of most older, most crumbling penal institutions in the country. There's been promises of building a new prison for several years, and so I think it's also quite telling that that's where we're seeing the most unrest.
So there's a few, I think, instinctual questions folks will have in response to what you're sharing with us. So I'm just going to ask both and have you respond. The first is, where are these prisoners? You know, there's a policy. They're not being released. This is not that they're out. This is that it's a furlough, right? It's a medical furlough. So where are they being kept, and under what conditions? Number one, in terms of what we can learn from that. But number two, and more pressing analytically based on your research, what do you think, based on the development of Iran's prison system, prepared the Islamic Republic to make this forward-thinking move at such a high rate, at such a quick speed, a rapid speed?
Yeah, so I'll answer the first part of the question first. Yeah, the release is quite a short-term medical furlough. At first, the release was going to be until about early April, the first week of April, and then just a couple days ago, President Rouhani said that it would be until about mid-April, the medical furlough. So they're slowly kind of trying to move, seemingly hearing that, okay, just a couple of weeks is really not going to be enough. And it's, from what we know, the incarcerated folks that we've heard from have largely been those who are prisoners of conscience, or people who have been arrested and incarcerated on essentially political crimes, right? And for the most part, they seem to be under house arrest. They're getting ankle bracelets. So they're still part of that kind of carceral continuum, right? They're not just out and freed. But the idea is that they're able to better quarantine and keep more social distance, right? And in prison, that's something that you simply can't do. As far as all 80,000 people, there haven't been good details about provincial, relatively, of course, this is going to affect people differently, right? Like, some people are going to have a home where they can go and be relatively socially isolated, and others are not. But at the same time, again, it's a kind of more of it's a medical furlough, and essentially a kind of a part of the carceral, as I said, part of the carceral continuum, where they're still being they're basically still sort of in the system, and they're expected to go back. So as far as the decision, though, I've been thinking about that quite a lot. Because Iran is one of the more heavily carceral states in the world. It has the 8th highest prison population in the world, although a smaller per capita rate than, most of the major powers, the U.S.
Not higher than the U.S., just to make
No,
sure.
no, absolutely not.
Nobody
No,
is.
absolutely.
Nobody is.
Nobody is. U.S. is, not only is the U.S. number one, but they're number one like 3 or 4 times over. But I think there's two parts of it. One is that there's a history of a longer standing history of medical furlough in the Iranian case, with other issues, with other public health issues. And so it's something that actually public health advocates have advocated for successfully in the past. So this wasn't a first, which has not nearly as much been the case in some other contexts. So this wasn't there was already an infrastructure in place in which they could, release a bunch of people and still have them relatively surveilled, right? So part of that is an infrastructural issue. And the other is, again, that I think the Iranian case, although especially drug users and people on minor drug offenses are incarcerated at extremely high rates, I don't think that the penal system has included all sorts of different components to the carceral continuum. So internal exile, sending someone to a far off place, exiling them to a different kind of carceral space, imprisonment, home arrest. These are all parts of the sort of structure of how the carceral system works there. And I think that broader mechanism allows for something like this, which is a welcome thing. It's welcome that they allowed 80,000 people to go to home even for a short time. As far as in a comparative model too, I think that there is just, I was trying to think what would happen if 80,000 people were released en masse in the U.S. context, or the sort of per capita, a third of the penal population was released en masse. I think you would see an enormous amount of sort of media antagonism towards that decision. Whereas in the Iranian context, I think that of course, the media is just going to be the Iranian media is just the state media. But in the Iranian context, I don't think that you have that same kind of antagonism towards the idea of releasing large numbers of people. It seems like there has been a fairly positive response to their decisions. So I think all of that kind of comes into play, because the way that incarceration is politicized in the U.S. and the way that it's racialized is quite particular, and leads to a real sort of antagonism towards incarcerated folks.
So I have two more questions. I have actually many more, but I'm going to limit it to two. One is about, let's focus on Iran and then go back to the global, because you were doing both right now, right? So I want to focus a little bit more on Iran before you take us, and this is all from your fantastic article. So on Iran, you have this great line that helps us think about it in a comparative context. That whereas in the early 1980s, it was the Reagan administration that basically pledged a war on crime that based on these very overt racial tropes that expanded our prison population exponentially. In Iran, it was based on, right after the Islamic Revolution, based on a policy of wanting to stamp out vice and sin. So can you tell us a little bit more about how you think about those things alongside one another?
Sure. So one of the things that I'm trying to do in my broader research is bring the conversation on prisons and prisoners in Iran to include all prisoners, right? We've gotten a lot of really brilliant work out of Iran and out of the Middle East more broadly on political prisoners, in particular, those whom we call political prisoners, folks who are part of political parties, who are incarcerated for essentially thought crimes or actions against the state that are political, overtly political in nature. But sort of influenced by a whole world of brilliant African-American activists, scholars, folks like Angela Davis, Mariam Kaba,
Wilson Gilmore.
So, Gilmore. There's the names go on and on. I started thinking about, well, the carceral rate in Iran jumps right at the same moment that it jumps in the United States. And it's not only these two places. There's a similar jump in Brazil in the early 80s. There's a similar jump in some East Asian countries. So I was trying to think of, a lot of the work on Iran really thinks, okay, well, what happens in 1980, 81, 82? Of course, that's right after the revolution. That's clearly why anything is happening, right? But then there's clearly more to it, right? If several states are thinking about engaging in a war on drugs at the same time, that's also part of a kind of global zeitgeist, right? But in the Iranian case, it's very clearly linked in the early part of the establishment of the Islamic Revolution towards a revolutionary promise of eradicating sin, vice, the sort of the problems that arise from a improperly moral public, sort of westernized public. So you have revolutionary leaders saying things like, well, there's mass arrests and mass incarceration and even mass executions of drug users, or on folks who are held on drug charges. And Iranians were being told in that era that this is part of a sort of cleansing, right? A cleansing that's going to eradicate these things from the face of the country. That did not happen. Drug use and drug addiction rates have only soared exponentially in the last several decades. And actually, Nora, to your earlier question about why we saw these medical furloughs, I think part of it is that we actually see in the Islamic Republic since the late 90s and into the 2000s a little bit of a shift in thinking on drug use, where there is more of an openness towards essentially what would be public health and sort of healthcare responses towards the drug epidemic in Iran. That is, you can't just carceralize your responses, right? So there are even quite conservative members of the government saying things like, we need to decriminalize certain kinds of drug use. We need to legalize you need to actually control these substances in ways that can help people not suffer addiction. So there's much more of an awareness in the last really 2 decades that addiction is a disease. It's not just something that is an issue of sin and vice, right? But that early 80s moment, that 80s and 90s moment was very kind of politicization of drug use around the revolutionary rhetoric of the state, that the state was capable, that Islam itself, an Islamic revolution, was capable of eradicating the problem of drug use in the country. And that, yeah, go ahead, Bassam, sorry.
And it's also, I mean, if you look at the early 80s and on to the 1990s, it was a time that much of the globe several countries were moving in a conservative direction in various ways, whether it's Thatcherism, Reaganomics, and the onset and the maturation of neoliberal policies that actually produced much higher rates of incarceration. In Iran, of course, you had the revolution. You also had a war in which critics had to be silenced, or basically the state had to act in a certain manner to deter critique and subversion. So a lot of this stuff actually is important as far as this question of incarceration. But I also wanted to ask you if I mean, I'm not sure if you're able to answer it, because it might be also a technical question. The rate of spreading of any sort of disease in prisons must be exponentially higher than anywhere else because of the proximity. Is this something that you can speak to?
Yeah, that's absolutely right. So if you look at there's actually the World Health Organization has an entire sort of component of its work is working on rates of disease spread in carceral spaces, and what folks need to do to try to eliminate certain dangers. And public health officials and prison advocates in Iran have worked on some of these things. I mean, in piecemeal ways and against sometimes quite hostile conditions. But part of the point that I was trying to argue in my piece is that there are certainly ways that you can make, if you insist on having sort of the modern prison system, like the one that we have, there are certainly ways that you can alleviate some forms of the spread of disease or human suffering, right? But you cannot eradicate those things, because the prison itself is a petri dish for disease. It is perfect space. I mean, and not just prisons, but all of the kinds of carceral spaces that we live with, refugee camps, internment camps, carceral sites. They are, by definition, and irrevocably, spaces where disease spreads, right? And so again, the rates of, for instance, across the board in every part of the world, rates of both diseases that we think of as relatively taken care of for the most part, and diseases that we're in sort of pandemic mode over, just ravage incarcerated populations and refugee populations and encamped populations, right? Because there is no way to socially separate, there is no way to quarantine, there's not enough access to medicine. So by definition, by incarcerating large groups of people, you are damning them to dying at much, much higher rates of both preventable and sort of new diseases.
And there's also a lot less interest among authorities to invest in discipline, in actually imposing discipline, because the costs are not as high. I mean, of course, there are attempts, but this is something that I've noticed. I mean, as you know, we're all at home, and I've been watching a lot more than I should of network television, and I haven't seen one serious report on these spaces, which is again a function of the lack of investment and interest in those spaces, not just on major network televisions, but in general, even in public discussions, even online. I have not heard or read much at all about this question.
Yeah, and I'll take it back to the sort of some of the points I was trying to make in the piece, which is that those who are caught in the dragnets of these wars on drugs in the 80s, for example, the Iranian one, those are political decisions by states, right? That we're going to undertake this kind of mass process of arrest and criminalization and incarceration, right? And those to begin with are drawn from populations of socially vulnerable peoples, right? It's overwhelmingly poor folks, people from socially marginalized communities. In Iran, again, there are refugee populations that are badly affected by the carceral state. And obviously also those who are politically active in the Iranian case are a vulnerable population, right? So that means that those populations, again, they're facing a kind of double marginalization. In the first place, in being brought into the carceral system, and in the second place by being sort of forgotten when a disease ravages that system. Now, Iran has been quite proactive about furloughing incarcerated peoples, but that isn't the case for every single epidemic. That hasn't been the case necessarily in these mass numbers for every disease that affects people. So you have people dying of preventable or getting quite ill from preventable illnesses who are already parts of poorer or marginalized communities. And that's, I think, what we see across the board.
I'll ask this and then I'll yield to Noura. So in your article, you talked about the actual or the reported deaths of several of the prisoners during that attempt to escape and so on. But the authorities in your article, you mentioned that they reported that only one person was killed and one prisoner was killed and one was injured. Do these sorts of things, and this is something we also asked our other friends a couple of days ago when we talked to them about Iran, is this sort of discourse, does it reflect the insecurity of the government, the officials regarding this whole issue, and do people in Iran, as far as you can probably tell, more than we can, do they catch that, and is there a backlash regarding that covering up or that sort of, that discourse of camouflaging some of the inconsistencies and shortcomings?
Yeah, I think absolutely. There is on the part of the populace a real skepticism about any number that they're hearing from the government right now, whatever that might be, whether it's specifically corona-related deaths, corona infections, or for those paying attention to these prison uprisings and escapes, the numbers that are coming out of that. Because if I, just talking to people, sort of talking to folks who in Iran who are looking at, know about the sort of carceral situation, or just looking at social media, there was rampant speculation that there was a much, much broader outbreak and many, many more deaths. And for me as a researcher, it'll probably take some time to actually figure out that, whether, I'm quite skeptical about the government's numbers, but the social media numbers are also probably inaccurate at this point. And so it'll probably take some time for us to have a sense of what really happened on those days. But there's absolutely a skepticism among most sort of ordinary Iranians about what they're hearing from their government, even those who are actually, quite not necessarily opponents of the regime broadly, because they're worried for their own health. There's clearly something more going on than people are hearing. It's very, very clear from when Corona was first, there was first announcements of deaths, of Corona-related deaths in Qom in mid-February to now, that there's just been a lot more happening that we haven't heard the numbers on. So there's real skepticism. And on the other hand, on the part of the government, I think, from what I can see, there's real worry as well. They're trying to minimize, and they're trying to portray things as under control. Rouhani said again just yesterday that he anticipates that things will be better by the time the New Year's holiday is over on April 3rd.
By Easter.
Yeah, same messaging. It's very, very similar messaging. Like, once this holiday wraps up, we think that people will, so there's this kind of constant messaging about things, being better than they seem. And I think that, the Iranian government is dealing with real mass skepticism in the wake of the November protests, and the wake of the downed airliner of the airplane, in the wake of the Corona crisis, but also just a crushing economic situation, which is a powder keg, and which will only become worse and worse as Corona-related sort of quarantining and social distancing takes further root. Because
Golnar, sorry, finish your thought.
No, and I was just going to also mention the escalating sanctions being the third part of the equation there. But
I wanted to, just as we wrap up, to take it back to the global scope that you also intimate and allude to in the article, which is about the prisoner revolts. You've mentioned already 3 in Iran, in several, at least 3 provinces, but you also referred to revolts in Italy and elsewhere in your article. So can you walk us through that as we think about this on the global scale, and thinking about a space that is out of sight, out of mind for most of the general population?
And before you start, sorry, and as you do that, feel free to sort of end with any last thoughts you have, so that we don't like, because we are so tempted. We were talking about this article before we spoke with you, so we don't get tempted ourselves to sort of keep asking, so that you can wrap up after you answer.
I will do my best. I will do my best. But yeah, so of course, I know the Iranian situation and the Iranian context better than the Italian or the other spaces where there seem to have been uprisings or revolts or unrest or incidents or whatever. I know of several, in fact, protests in over 25 prisons in Italy, seemingly spreading like wildcats style. Having to do both with fears of corona and also just the sort of top-down brutal imposition of these draconian measures, and especially the sort of curtailing of all visitation rights and all any kind of contact to the outside world, because that is in itself terrifying even in non-corona situations. So there's been several sort of protests in Italy, and the right-wing Italian government has promised an iron boot response. That has been their own language, and they've been very, very slow to release incarcerated folks. They've released a couple thousand, but there's been calls for more. There was a big protest in Bogota, Colombia. There's been some signs of unrest in other places as well, but it's hard to link. It's hard to know if exactly, because the governments are sort of suppressing information about them, and it's hard to know exactly what's on the prisoners' minds, what's on the people on the inside's minds when they're protesting. Because even in our normal circumstances, there's many prison protests that we don't hear about. And there are, of course, in the U.S. context, there's been several hunger strikes in both in ICE detention camps and in sort of ordinary detention situations. So there's a wide range of different strategies that incarcerated folks are using, and folks who are being held in encampments are using to try to bring public attention to their plight. Which is why in the article, the big takeaway for the article for me, and a big takeaway for me in the book that I'm working on more broadly, is that we really need to expand, especially those of us who think about and work on Middle East context, we really need to expand what we mean when we talk about political prisoners. There's clearly those, and in the Iranian context, clearly there are many hundreds and thousands of people who are arrested for their political ideas, and that we should be using our every last breath to fight for those folks. But at the same time, even those on, let's say you're arrested on drug charges or sex work charges, or you're a refugee, or these are all part of a long-standing process of political decisions, political institution building, and processes in which certain people are rendered vulnerable or rendered disposable, and others are rendered sort of more valuable, right? So it is my position that we have to think about all of these as political prisoners in a certain way, or to at least start thinking about how we can connect these different movements. There shouldn't be sort of public health movements over here fighting for a few rights of some prisoners and others. There's got to be a way to kind of connect these conversations, because we have to sort of think about the ways in which just ordinary folks who are captured in the New York City dragnet and are at Rikers are themselves the victims of political decisions and political processes. So in the U.S., we know that these are poor people and people of color, particularly African Americans, Latinos, and indigenous folks. And of course, that's also the case in the Iranian context, where we've seen these uprisings in these provincial areas. There was just an uprising 2 days ago in Tabriz with a lot of Kurdish prisoners in particular. So again, socially vulnerable people are often caught in these carceral systems, and we have to think about that as a broader political project, and then focus our politics against it, right? That is a political project, then our own political project has to think expansively about these links.
Thank you so much, Golnar.
Free it, Mo.
We could actually go on and go. We can actually go on and on. But if there's anything else you or Noura would like to say before we wrap up, and I'm sure we will speak again.
Yes, just thank you guys both for giving me the opportunity to come on here and talk to you today. It's nice to see your faces in these quarantine times.
Same here.
And we'll be in touch.
Yes, absolutely.
Building. Yeah.
Thank you so much, Golnar.
Take care.
Talk to you soon.
Freedom all. Take care.